What's up, guys? Dr. Bob back to teach you a little more to boost your immune system this winter time. We're going to talk specifically about the lymphatic system right now. So the lymphatic system works similar to the filter in a fish tank. And if your fish tank starts turning green, you can easily clean the inside of the tank. But if it keeps coming back and getting cruddy, like you might be continuing to get sick all through the winter time, you've got to look at that filtration system and see how you can improve how it's working. This is one way to improve the filtration system that your body has to get sick less frequently and expedite the process when you do get sick. Now, I'm going to demonstrate self-lymphatic massage for the top half, we'll call it half of the body, as far as the half of the lymph nodes that we have. That's particularly helpful when we're sick, but there are more than that we can show in a future video. It's particularly important when we're doing self-lymphatic massage, though, to remember that the order that we do these massages in is very important. So we're going to work from here and gradually touch all of the lymph nodes up through our chest and neck. And we're going to do it in a sequence of 4 movements that are going to help stimulate the movement of the lymphatic system. So the first thing that you're going to do, and I'll show you on myself here, is you're going to start at the lymph node just above your collarbone. And you're going to use a really light and gentle self-massage there. It doesn't have to be fast. And I like to use both hands here and go on both sides at the same time. Slow and gentle for about 5 seconds. Then we're going to increase the depth and intensity that we're massaging with, as well as the speed. So this is going to be deeper and faster, but it doesn't have to be heavy massage, just enough to really get things moving, okay? Once we've done that for 5 seconds, we're going to move on to a tapping or a patting method that we're going to use on the lymph node like this. At a decently fast pace, we're looking for about 150 beats per minute, okay? You don't need to get a metronome out or anything like that. Once you've done that, then you're going to do 3 deep, slow, sustained muscle drags. And what that part is doing is specifically stimulating the nerves that live around those lymph nodes and moving that lymphatic fluid toward your chest so that it can drain properly. Once you've done the one above the collarbone, the next one that you're going to move up to is along the sides of your neck. So if you feel along the sides of your neck, if you're sick already, these may be tender. That's going to be the area you'll work on next, and you'll use that same system to go through. So 5 seconds of light touch, 5 seconds of that deeper and faster pressure, 5 seconds of tapping, and then the 3 sustained pulls. The next one you're going to move up to is one of the most common ones to get irritated and inflamed when we're sick. That's in the upper cervical spine or the upper neck, just behind your jaw and underneath your ear. After you've done that one, you'll do the same sequence around the jaw here. This is another one to get commonly inflamed and irritated when we're sick. And once you've done that, you're going to move up to the maxillary sinuses right next to your nose. This can be an area where you might be feeling pain already if you have a sinus infection. You might be draining a lot of mucus. The next one that you'll move to is here above the temples, kind of like start where your sideburns are and work up into the temple area. And then the last one is an optional one. This is the last one that you would work up to, though, and that's going to be back here along the suboccipital region. And yeah, that's it. I encourage you to go to work, get started doing some self-lymphatic massage. If you can do it before you start getting sick, that's fantastic. Now, afterward, you may start to feel what we call detoxing symptoms if you're not sick. If you are sick, you may feel either a temporary increase in symptoms because you might be getting old infections out, or an immediate decrease, in which case that's awesome. Keep going with it. But if you experience any increase in symptoms, you're not going to do this series of massages again until those symptoms have disappeared. All right, guys, have a great day. Go to work.